This is Chris Kiefer from EM Deliberate Practice, here with Tero Halfnight. And Tero is one of our pit stop crews. So when we are putting this course on, we have a very low instructor to participant ratio so that we can pick up mistakes and identify learning opportunities and provide rapid feedback. And part of the beauty of the partial task trainer that we have here is that we're able to rapidly cycle over and perform a lot of reps. So on our early reps, when the participants are just learning, we can use very thin pieces of the pigskin, and that really makes the anatomy very easy to identify through that thin pigskin, and maybe would imitate, the neck of someone who had not a lot of fatty tissue over their airway. Okay, and then as the workshop develops, particularly when we want to go over our bougie micro skills, remembering that when you have a lot of tissue in the way, it can become quite difficult to feed that bougie down past your finger. Tero has developed a way here to create a much thicker neck here just by doubling over the pieces. And you have skin on both sides, but that skin on the back side actually is a nice, gives you good sort of proprioceptive information regarding a possible cricothyroid membrane on the back. So here it's much harder to landmark. And what the participants need to do when they have a neck with a lot of tissue like this is what we call that surgical assisted landmarking, where they make a long vertical incision, really opening up the anatomy so that they can palpate again. And really just using the same technique as was used before in terms of starting at the sternal notch and walking their way up, but they've removed a lot of the overlying tissue and are therefore able to identify properly the landmarks and perform this procedure as safe as possible.